Okay. All right. Welcome, Crown Council members. This is Stuart Anderson. I'm joined with Dr. Guy Gross. He's part of our little mini mentorship webinars that we're doing. I've asked Dr. Gross to be with us to share some of his philosophies and standards in his practice at New Horizons Dental. And I'm grateful to have Dr. Gross with me. I've known him for years. Goes way back. We shared some really great experiences together recently on a humanitarian trip that I cherish with he and his family. So I look up to Guy a lot, and I think that what he can share with us today from a mentorship standpoint will be very applicable for anyone looking for associates or multiple practices or just working with other doctors in the practice. So thanks, Guy, for joining us. First, you got to show the t-shirt, man.
Oh yeah, the t-shirt. It's my lifetime qualified member t-shirt.
Yeah.
You know, most of my Crown Council t-shirts are, like my favorite clothes to wear. So, when I'm on my COVID-cation, I have a chance to wear them a lot. So,
Nice.
Probably my kids are like, "Do you have anything else?"
Nope.
So anyway, yeah, nope, this is it. Something with an eagle on it. It's got to be that pretty much every day. Keep her moving forward.
It's actually a good thing to reference. It is April 16th, 2020. So we are in the middle of kind of COVID, in the heart of COVID here. And that's kind of what sprung this idea is maybe you could start, Guy, with telling us, what you are doing with your team now, what's kind of guiding you and how you're interacting with them.
Yeah, well, I think that, over the years, I've always really worked to copy the genius, and a lot of my best ideas and things that I've assimilated have come through Crown Council and the speakers, the mentors on the Mentors of the Month, the podcasts, and books I read and things like that. And so, I years ago, we decided that communication was our number one core value in our company. And so that communication has been the biggest thing that we've really focused on during this period of time, because I find that in the middle of all of it, there's lots of unknowns, a lot of anxiety that comes from that, a lot of uncertainty and concerns. And so, with our organization wide, we're having a weekly team meeting on Zoom where we get everybody together, give updates on, where we're at with everything from the government things that are coming down, the timelines, what we're hearing, what we're doing for safety, what we're doing to see patients. And, and it's been a moving target every week. So communication has been a big part of that. And in the middle of that, I decided with the doctors, like, look, we can rally and take control of what we can control, or we can sit here and, worry and fret and, kind of basically be passive to what's happening around us. And what I ultimately did is I fast-tracked a leadership program that I had been working on to where, we spent about 10 two-hour sessions on leadership topics, everything from basically the process of leading yourself and getting clear on where you are as a leader, and then on through, seeking out, the brilliance of mentors and great books that have been written. And we did some homework together, and then we'd work on it together. We worked through that process to ultimately arrive at a conclusion. And what came of it was a group of doctors that I saw really learning and evolving together, so that was a lot of fun. And now, since the time that we're going to be down from the practice, I just saw that, at least in our state, things are extended until, gosh, what is it, May 3rd, May 4th, I think, so that's how long we're going to be down for sure at this point. And I'm, quite frankly, I guess longer, but we're going to work into clinical topics, a lot of training around all the different things that we, that our doctors have put forth that we want to learn, everything from complex restorative to simple restorative, pediatric work. We're doing a bunch of stuff on Invisalign and ortho, some implants and implant restorative things. So we've got a lot of topics we're going to hit. and ultimately trying to come out ahead where we're all better prepared as leaders and better prepared as clinicians when we get back to work.
Nice. And how is that different from, can you walk us through the normal calendar plan of how you train and organize your team members just on a regular basis outside of COVID-19?
Yeah. So our focus is, from the very first day that people come into our organization, we start onboarding them into our culture. And a big part of that is centered around, teaching them, our mission and vision, the reason why we exist, the ways that we use our company to serve others. We teach our culture guide. We teach around living examples of people living out the culture guide. We spend a lot of time talking about, really a great team and a great team member is someone who serves their teammates first and serves patients second. And we spend a lot of time really digging into what that means and how that manifests and all of that. So every single team member is onboarded in the way of culture first. And then, all of those team members additionally go through what we call like our new patient relationship workshop, where we train on the way that we go through the process of everything from, the initial phone calls and all the way through the clinical process of, diagnosis, treatment planning. And it's really we have a patient-based program. I use, honestly, like I love the things that Steve Anderson teaches in his TOPS programs. And he does an amazing job of teaching the verbal skills. And so, I've worked with Steve and TOPS, for years. And then, it gradually morphed it into where we have our own program that's really around also adding in actual patients into the treatment planning, to where we can dig into like a skills practice on every skill that we want to teach. And even then with actual patient scenarios, looking at radiographs, looking at photos, diagnosing a case, working up the case, presenting treatment, getting case acceptance, and ultimately scheduling those patients. So we have a process that we take people through with that. And then, so it keeps with the team members, most all of our team members have ended up going through that course a few times. And then our doctors, they have access to, we take them through like efficient restorative case work, the way to do efficient, even class 2 posterior composites, crowns, endo, so that they can get training not only on a lot of what we think are the most efficient, effective ways to do all those treatments, but get hands-on practice with all of that. And then as they're ready, they go into complex case planning, dental implants. I do a lot of one-on-one training on surgery. So my niche really in the training world has been dental implants. And so they come to my courses that I'm teaching on dental implants, usually 2-day courses. And then they'll come work with me directly, watch me work. And then as they're ready, they do the work and I watch. And eventually, they're on their own. And that goes everything from a simple single implant placement to sinus lifts to you name it. So, it's not a like something that you can do really fast, but in a matter of a year, I've had doctors join forces with us that are like, they've done AEGD and GPR residencies and things like that. And they're like in the first 3 months with you, I learned more than I did in a whole year at the residency. So, that makes me feel good knowing that we're doing something right, I guess.
Yeah.
So that makes it fun. And I don't know, other than Steve Anderson and, the way that we're doing things, I don't know of a lot of other great ways to really learn the verbal skills, which I don't think that, you could even overstate how powerful and impactful that kind of stuff is to being able to really be an effective dentist and a dental team, and to have a team that rallies around those concepts is huge. You can't do it all just by being the dentist that's just great at everything. You got to have a team around you. And so I'm wholeheartedly bought into team concepts, and that's what we teach.
Well, and just to give some reference, Guy, talk about how many people you are talking about that are part of your team. This isn't just a couple of people.
Yeah, well, I mean, and we're, on the scope of dental groups, we're not necessarily enormous or anything, but we have 16 doctors that are, they've been on our calls each week, that a couple times a week that we've been doing, our training. We have, I believe our team member numbers are around 100 and 110, maybe something like that. So, it's, we're not huge. We cover practices in Kansas, Oklahoma, and Missouri. So we're growing. We're doing things in the best way we know how, and we're doing the best we can to learn from others and make sure that we're trying to do it right, and most of the doctors that work with me, and I find this to be the case for associates in general. And Stuart, you mentioned, hiring associates and kind of the way to think about that. But what I find is that most of the young doctors, especially as we work with docs who are coming out of dental school, fairly recently out of dental school, maybe haven't had a mentor yet, that they really want some active mentorship. And so there's lots of associateships that are entered into where it's like, hey, just come ask me questions when you have questions, and I'll be here if I'm not golfing or whatever, and it's one of those things where people leave it to chance. And so by chance, it doesn't really happen very well. And what we've discovered is that it needs to be just like anything else. It's got to be a system. It's got to be a design, something that you plan for, that's in your, even if you're hiring an associate and you say, hey, I want to just let's plan on every Tuesday, we're going to spend 1 hour and we're going to cover these 3 topics, or we're going to, that would be way better than leaving it to chance, and all of that, and then have a set agenda for what you're going to learn and grow into, because there's so much, and it needs, you don't unfortunately come out of dental school really ready to go kill it. And I find that, even doctors that have been practicing a long time, if they weren't really mentored, they haven't really seen the top end of the spectrum, what it can become. They maybe have developed some habits that could be improved upon, and would allow them to, attain new levels that they never even thought were possible. I know that, Stuart, you probably see that all the time with doctors in the Crown Council. But I know that is absolutely the case. Some extra intentional design to your planning will make a tremendous difference to the trajectory of your career.
Definitely. And Guy, if you were to give advice, like let's say you were going to give advice to someone looking to hire an associate, or an associate looking to be hired, you've had an incredible amount of experience with that. Any top 3 things that associates should be doing, or doctors should be looking for in associates that you see kind of works or doesn't work?
Yeah, well, okay, so I'll start with the doctors looking to be hired. I have 4 things that I speak about to the docs that are interested in working with us. And, I say, look, if you have these 4 traits, everything else is figure outable. We'll get there. We'll make it work, and you'll have a great career. And the first one is be willing to do the hard work. So in some ways I see this notion that, it's like, okay, I got done with dental school and now I can kind of coast and I start getting a paycheck, and it's, I'm going to be rich pretty quick here, and it's like, not really how it works. In fact, you may have some harder work than you can imagine until you get good at all this stuff, because it's going to feel hard before it gets easier. And if you're pushing yourself, it never really gets easier. You just get better. And so it seems easier. it just takes less brain power to be great at what you're doing, as you're not having to grind the gears so much thinking about it all the time down the road. But work hard, be willing to work hard. Don't just assume that, I'm going to only work 3 or 4 days a week, and then I'm going to take those other days off and I'm not going to do anything. I mean, you got to think that if you are not working clinically 5 days a week or 6, then the days that you're not working, you really should be investing in yourself somehow, and not just sitting, on a lawn chair or whatever on your couch. So work hard, number one. Second thing is treating people with respect. And this isn't a huge deal a lot of times, but when it is a deal, it really matters, and it breaks the deal hard. Is if somebody comes in thinking that they're better than everyone else, they treat their team members like they're just straight up subordinates, and they just don't have that healthy respect for patients to say that, I'm willing to go above and beyond and serve and all of that. That's a deal breaker in a big way. The third, so treating people with respect, hard work. And then the third thing is being coachable, being a lifelong learner. So being willing to accept feedback, even if it isn't really what you want to hear, even if, it isn't somebody telling you that you're the greatest, gift to dentistry, just understand that, hey, it's a learning process, and that if somebody loves you enough to give you feedback and coach you, then you've been blessed, and that's a good thing, and you get to choose what to do with that information, but be coachable. And then the fourth thing is to think like the owner of the business. You may not own the practice, at least not yet, but you should think like you do. So make decisions around it that are healthy for the business. It's the 3 Ps I teach that are, it's the people, which are the team members. It's the patients, which are obviously who we serve. And then it's the practice itself, which is the business of the dental business. So you have to serve all 3 of those things if you're really going to do it. And a lot of times decisions are made that are self-serving when they really need to be bigger picture decisions around treating the team members, the patients, and the practice better. And, we don't on the cheapest insurance plan do like, go ahead and send the case off to the highest end lab. That wouldn't be a healthy business decision. That's just an example. You certainly wouldn't give away your work if you were responsible for paying the electrical bill, stuff like that. So anyway, there's things that all matter in terms of understanding how it all works together. But for me, those are the top 4 for a young doctor. For the dentists themselves, you can't hire an associate. I should say, for the hiring doctor, you can't hire an associate and just think that, okay, now I can go play golf every day. It's going to actually take some investment and some work. And you got to understand that in some ways you may be investing, and it's going to seem harder at first. You're going to seem like you're working harder than ever, spending more time than ever. You're going to be answering questions. You're also going to find that there's sometimes going to be problems that you have to solve that are new because, well, you've got a young doc that doesn't know as much, as it doesn't have as much experience right now, and they just need to be coached and given time to learn, just like you did when you were young. It's not a fast track to the golf course. It's a thing that you've got to invest in and make the outcomes what you want them to be, rather than just expecting that, it's automatically going to make your life easier. The other big thing, I mentioned earlier, communication and intentional design of how you're going to mentor and train and teach, but, don't cherry pick, the cases. I've seen so many associateships fail where the hiring doctor brought somebody in and then they're like, they really didn't have enough work to do for 2 doctors, but and so they kind of feel like they're losing money if the young doctor is doing a bunch of crowns. And so they start taking those cases themselves. And, next thing they know, their associate is a glorified hygienist who rapidly becomes very unhappy and is ready to get the heck out of there as soon as possible. If you will invest in them, help them do those cases better, help them learn, help them grow, and come at it from an abundance mentality that there is enough to go around and it's a good thing for for them to do lots of work. If you do it that way, I think you'll find that, it is long-term healthier, and that's a way to invest in the practice itself by investing in this new person rather than thinking that, you're going to run out of work to do or something like that. And preemptively, the hiring doc can certainly do a bunch of work to really ramp up the practice. I mean, you almost got to think, I'm going to have to work harder than ever to bring in a bunch of new patients, get the practice really like maxed out to where I cannot handle anymore, and then bring that associate in, because if you really don't quite have enough work for even 1.5 or 2 doctors and you hire that additional doctor, you might have a tendency to jump into that scarcity mentality, and that's not healthy.
Got it. We only have a couple minutes left, but is there any relationship? I don't want to focus on the negative stuff, but is there anything that you see that usually brings that associate stuff that they can be aware of that maybe doesn't work out or fail? I'm not saying failures, but things that you've watched that makes those relationships just not work.
Yeah, I think that if you stick with the fundamentals of really communicating well, when people are left, kind of in the dark, where they don't feel like they know really what's going on, where you stand, what you're aiming for, if you're not clear on what you need out of them in the practice and being really honest about that, then what happens is people start to, kind of make up stories on their own, and they fill in the blanks. And sometimes that's not a very healthy, good story, And so if the associate's sitting there thinking, well, this doc said they were going to retire and I could buy the practice, and now they're like, they won't go away, and you haven't addressed that, well, you're going to lose that person most likely. If you said you were going to help them do a bunch of work and meet with them, help mentor them, but you haven't really invested in that and scheduled it, then they sit there and think, well, okay, this has sort of been a bait and switch kind of deal. So it really is about communication and consistency and executing that plan, so that, you always have a forum for them to be able to say, hey, let's talk about this, or, tell me where you're at, what you're concerned about, how I can help, how I can serve you, what challenges are you having? And, and essentially think of it like a SWOT process, going through what's working, what's not working, where the opportunities are, what's standing in the way, and having that conversation on a regular basis, so that you don't have, a doctor, whether it's the hiring doctor or the young doctor, sitting there kind of making up their own story about what's happening, because a lot of times that's an unhealthy story.
Yeah. Very cool, Guy. I love this list. The hard work, treating people with respect, being coachable, and thinking like the owner. And I love that. People, patience, and then the practice. Dude, that is some good advice. Excellent. You are mentorship quality, my friend. Well done.
Thanks, dude.
Hey, so I'm going to wrap up. I want to keep these kind of shorter, so you can we can watch them fast. But I know there's so much more here. Maybe we can expand this into a full Mentor of the Month, interview and recording.
Yeah.
I'd love that. So
I'd be happy to.
Cool. Well, thank you, sir. I appreciate your help. I don't know what you're going off to do now, but
I'm off. Lots more to do yet today.
Go vacation. I'm going to use that from now on. Nice.
Right on.
Right,
Thanks, Stuart.